One. We got another vaping-related death. This time it's a 17-year-old in New York City, the youngest victim. That brings the total deaths from vaping-related illnesses to 23. Now, this afternoon, First Lady Melania Trump will bring youngsters to the White House, highlighting the dangers of vaping. Joining us now, HHS Secretary Alex Azar. Mr. Secretary, if I'm not mistaken, you're going right at these flavored vaping devices. That's the main thrust from your department. Have I got that right?
Well, that's right. What we're trying to do is make sure that kids don't have access to products that are particularly attractive to them, and that would include these flavored e-cigarette products. Now, it's not a ban. It's enforcing the law that Congress passed that said that if you want to have e-cigarette products on the market, you actually have to go through FDA approval. And we're saying it's time to get into that process, come into FDA, see if your flavored products can get approved through the public health standard Congress set, and you can be back out there in ways that are not attractive or available to kids.
But that still leaves you with the vaping problem, people getting hold of a vaping device and putting other stuff in. And it's that other stuff that gets into these vaping devices that's causing most of these problems and deaths.
Yes, Stuart, it's two separate issues. The e-cigarette crisis with our kids in terms of them using these nicotine delivery devices is one problem, and that's something the First Lady and I are very focused on. The other issue is the one you're raising, which is the broader vaping question, which is using any number of other devices to put things into your lungs. Most of these cases seem to involve the use of THC, which is the active ingredient in marijuana, and other ingredients maybe to cut the THC or otherwise make it available. I want to be clear, though, as we do at CDC and FDA, the epidemiological research on this, I doubt we will ever find one single cause for all of these cases. There will be trends, there will be certain common products and ingredients that are at issue, but we're talking about homebrew, adulterated products, unregulated products, and so I think we're going to see a multiplicity of factors that are at issue here. The bottom line is when you put things into your lungs, it's not a great thing.
Yeah, that's entirely right, isn't it? You put this alien stuff in there and you're going to have a problem, probably. Yep. Now, the administration is taking steps to ease these anti-kickback rules for doctors and hospitals. I believe they were put in place to prevent bribery and fraud. So why, Mr. Secretary, are you rolling them back?
Well, Stuart, on both the left and the right for decades now, we've said that what we need in healthcare is more collaboration and coordination among hospitals, doctors, insurance companies, and patients. But we've got a couple anti-fraud laws dating back to the late 80s and early 90s that say that if you collaborate and coordinate, you just might go to jail. The president is proposing today that we enable these entities to work together where they have value-based arrangements, so common sense reforms so that they can work together to deliver high-quality outcomes and better value. You know, Stuart, we've talked on your show before about the incredible consolidation of healthcare providers. Well, part of what's been driving that is the fact that you're exempted from many of these laws if you're owned by the same entity. We're leveling the playing field here so that you can collaborate and work together without being consolidated and bought up. It's real common sense, good reforms.
Would you comment on the Johnson & Johnson situation? I've got a bee in my bonnet about this. A jury awards $8 billion to a plaintiff who said, hey, you didn't warn me about the dangers of a Johnson & Johnson drug. Seems to me that big American corporations are being taken to the cleaners by rogue juries and lawyers. Any comment?
Well, Stuart, I want to be careful not to comment on any individual piece of litigation, especially not one the United States is involved in and has an interest in. So I need to be careful about that there. So I'm going to take a pass, I'm afraid.
You're a diplomat, sir, and so you should be in your job. Health and Human Services Secretary Alex Azar, always a pleasure. Thanks for being with us today, sir.
Thank you, Stuart.
Sure thing.